Today, we uncover the often overlooked signs of celiac disease and dive deep into the subtle clues that often go unnoticed for years. First, let us explain what celiac disease is. Celiac disease is an autoimmune disorder where the ingestion of gluten, found in wheat, barley, and rye, triggers a harmful immune response in the small intestine. Here's a quick breakdown. When someone with celiac disease eats gluten, their immune system mistakenly thinks it's a threat and attacks the lining of their small intestine. This immune response damages tiny hair-like structures in the intestine called villi, which are responsible for absorbing nutrients from food. As the villi become damaged, the body struggles to absorb essential nutrients like iron, calcium, and vitamins, leading to deficiencies. Celiac disease is one of the most misunderstood autoimmune disorders, and its symptoms can be much more complex than many realize. While we typically associate it with gastrointestinal issues, bloating, abdominal pain, diarrhea, this condition can actually manifest in a wide variety of ways. In fact, according to the Celiac Disease Foundation, 1 in 100 people worldwide are affected by celiac disease, but up to 80% of them remain undiagnosed. This means that millions are living with symptoms they might not even realize are connected to this autoimmune disorder. The most common symptoms, like digestive distress, are only the tip of the iceberg. Celiac disease can also cause unexplained fatigue, headaches, joint pain, and even skin rashes, such as the itchy condition known as dermatitis herpetiformis. In fact, about 25% of people with celiac disease experience neurological symptoms such as brain fog, mood swings, and even depression. These more subtle signs often fly under the radar and can easily be mistaken for other conditions, making diagnosis tricky. An interesting fact: celiac disease can also present with symptoms in other parts of the body, including the mouth, with ulcers or a dry mouth. About 10 to 20% of patients with celiac disease report experiencing dental enamel defects, leading to weakened or discolored teeth. It's another clue that many people miss or dismiss. Even more surprising is how celiac disease can affect children differently. For instance, in young children, symptoms like poor growth, delayed puberty, and irritability may be early signs. Studies show that up to 30% of children with celiac disease do not experience typical digestive symptoms, and their diagnosis is often delayed because the condition presents in such unusual ways. The key takeaway here is that celiac disease isn't just about digestive problems. It's a multifaceted condition that can impact your whole body. Recognizing the subtle signs and getting tested early can help avoid long-term health complications, including osteoporosis, infertility, and even an increased risk of certain cancers. If you or someone you know is experiencing any of these unusual symptoms, it might be time to consider getting tested for celiac disease. Don't let the hidden signs go unnoticed, because the sooner you catch it, the easier it is to manage with a gluten-free diet. Before we continue, take a moment to like this video. By doing so, you'll help spread awareness about celiac disease and its hidden signs. Misdiagnosis is a significant challenge when it comes to celiac disease, and it's more common than you might think. Many people are initially told they have irritable bowel syndrome, IBS, anxiety, or even depression, when in fact, they're actually dealing with celiac disease. The issue lies in the fact that doctors often focus on the most common and obvious symptoms, like digestive issues, and tend to overlook the less obvious signs that are actually key to diagnosing celiac disease. This leads to a situation where it can take years, sometimes decades, before someone gets an accurate diagnosis. In fact, studies have shown that the average time to diagnosis is around 6 to 10 years, which is a staggering delay when you consider the long-term health consequences of untreated celiac disease. During this time, individuals may suffer from a range of unexplained symptoms: fatigue, joint pain, mood swings, or even skin rashes, that can cause frustration and confusion. They often find themselves bouncing from one specialist to another with no clear answers. What's even more concerning is that misdiagnosis can lead to serious complications. If celiac disease goes untreated, it can result in long-term damage to the small intestine, malabsorption of nutrients, osteoporosis, infertility, and even an increased risk of certain cancers. The sad truth is, many people are walking around with undiagnosed celiac disease, and it's impacting their daily lives in ways they may not even realize. They might be experiencing fatigue, brain fog, joint pain, or even skin rashes, and they have no idea that these symptoms could be linked to a gluten intolerance. Fatigue is one of the most common hidden signs of celiac disease. It's not just feeling tired, it's feeling exhausted, like you've been running on empty for weeks. And it's not just physical fatigue, it's also mental and emotional. You might feel like you're stuck in a fog, like you can't think clearly or make decisions easily. It's a debilitating feeling, and it's something that many people experience without realizing it could be connected to celiac disease. Skin rashes are another common symptom that often gets overlooked. Dermatitis herpetiformis is a type of skin rash that's directly linked to celiac disease, and it's often misdiagnosed as eczema or psoriasis. The rash is typically itchy and blister-like, and it can appear anywhere on the body. Neurological symptoms are also common in people with celiac disease. You might experience headaches, migraines, or even seizures. Some people might develop numbness or tingling in their hands and feet, which can be really frightening. And in some cases, people might even experience anxiety, depression, or mood swings. The brain is directly affected by gluten, and it can lead to a wide range of neurological symptoms that are often misdiagnosed as something else. So, how do you find out if you've got celiac disease? Well, it usually starts with a blood test, where doctors look for specific antibodies like TTG or EMA. Think of them as your immune system's overzealous army attacking gluten, but for no good reason. If the blood test points to something suspicious, the next step might be a biopsy, where a doctor takes a tiny piece of your small intestine to see if it's been damaged by the gluten invasion. Now, here's the catch: if you're already gluten-free before the test, it might not show the full picture, so you'll need to keep eating gluten. Yep, you heard that right, for accurate results. Once diagnosed, the only way to deal with it is a lifetime commitment to a gluten-free diet. That means no gluten at all, like, not even a crumb. Because even the tiniest trace of gluten can send your immune system into full-on attack mode, and trust me, you don't want that. When it comes to the diet for people with celiac disease, it's pretty straightforward: gluten-free is the way to go. But here's the thing: gluten is a sneaky little devil. It's hiding in so many places you wouldn't expect, like in bread, pasta, cakes, and even things like soups, sauces, and processed foods. So, if you're diagnosed with celiac disease, your new mantra becomes, if it has gluten, I can't eat it. Your shopping cart will now look a little different: fruits, veggies, lean meats, eggs, dairy, rice, and potatoes are all your best friends. You'll be hugging your favorite gluten-free grains, like quinoa, rice, and oats. But check the labels. Oats are like the wild card of the gluten world. Some are cross-contaminated. And yes, you can still enjoy bread and pasta, just make sure it's the gluten-free version. Now, let's talk snacks. Gone are the days of grabbing a quick sandwich, but say hello to gluten-free crackers, nuts, popcorn, and a million other delicious gluten-free treats. And here's the best part: you'll feel a lot better once you ditch the gluten. It's like a magic trick: your stomach stops complaining, your energy improves, and you might even start feeling like the superhero you always were, but now with fewer digestive complaints. Thanks for watching, and I hope this video has encouraged you to think differently about celiac disease. If you have any experiences, please leave them in the comments below. And if you're interested in learning more about health and wellness, be sure to check out my other videos.